Hi, Dr. Nurse Podcast. So thanks for tuning in today. Today we have such a special guest. Jackie King is a board certified family nurse practitioner, and she's been working in obstetrics and gynecology for 15 plus years. And she is the founder of the Perfectly Pregnant Collective, which is an online education series that prepares expectant mothers in their journey to motherhood. She's also some creative endeavors involving being on Airbnb as a super host, owning a short-term rental. She's also recently launched her Etsy shop, SuccessNP, and we actually are in business together. That is my Etsy shop partner, and we are just enjoying creating digital downloads and things on the internet to support nurses. In her free time, she enjoys spending time with her husband and her 3 rambunctious boys that are just so sweet. She's got the cutest little boys. So yeah, welcome, Jackie, to the podcast.
Thank you. I'm so excited. Thanks so much for having me.
For sure. So we wanted to just chat. We've been friends for how long, Jackie? How long have we been friends? My friend?
Long time. So we met in undergrad at the University of Florida. So what was that? Let's not date ourselves too much. That was about 16 years
Jackie,
ago.
Is that so? Oh my goodness. Yes.
Yeah, we were 20. Yeah.
Oh, geez. So yeah, 16, almost 17 years ago.
Yes.
That
We've known
is
each other
crazy.
a long time. I know.
Wow. So yes, as you can hear, guys, we've been friends a long time. So we have just decided through all of our endeavors that we were going to launch our Etsy shop together. But I want to hear from the beginning, Jackie, kind of take me through a little bit about yourself, what you've been doing, and all the hats you're wearing right now.
Yeah, sure. So like you just mentioned, we went to nursing school together at the University of Florida. And then after graduating there, I came back home to Miami. And just like all of your podcast guests say, they did not go into med surg and they went into specialty, which is what I did. I did labor and delivery. And so I started labor and delivery and worked there for a few years. And while I was working there, I also went back to school to get my master's degree in nursing to become a family nurse practitioner. Once I graduated there, I kind of went into private practice and into women's health. I've kind of never left women's health. So it's been my passion for my career, still in it, still working part-time. I do 3 days a week, which is nice, in a private practice. And then I round in the hospital for my postpartum patients to kind of facilitate discharge and educate them there as well.
Wow. That's really cool. You've got your foot in the hospital and you're also doing clinic work. Because I think a lot of nurse practitioners, have to be grandfathered in, like with acute care.
Correct.
And you're a family nurse practitioner, right?
Yes. So I think it was at least down here, I don't know if it's nationwide, but a couple of years back, they did transition where you had to be an acute care nurse to round in the hospital and be on medical staff. So we were one of 3 I know in women's health that got grandfathered in. So it's pretty cool.
So tell me a little bit about some of the other things you've got going on. That's the thing I find the most inspiring about your whole career is the fact that you're just constantly doing something outside of your job to get income. So tell me a little bit about that.
Yeah, so I love what I do, but I think there's always a time where you kind of itch for a little bit more, just kind of to pour your creative side and you just want something different. So this last year has really been, I feel like, my year of innovation. I've kind of just dived into the whole side hustle world. And like you mentioned earlier, I started my Perfectly Pregnant Collective, which is that online on-demand education series. I was doing one-to-one childbirth education before the pandemic, which was nice, but also had some cons to it. You're sitting there for 3 hours with this couple and, pregnancy brain, you don't retain a lot of information. And so, it was nice to be in person, but I feel like the on-demand aspect is a little bit nicer because you can actually, do small portions on your own time and it's pertinent to whatever you're going through, So the courses are prenatal education, childbirth education, cesarean section prep, because I feel like that's overlooked. And a lot of the moms, you never think you're going to have one. And then there you are in the labor room, someone's telling you you're about to have a C-section. So we go over all of that as well, like what to expect in the case that you need it. Breastfeeding, postpartum recovery, newborn procedures, and then just some pelvic floor training postpartum. So there's a lot there that you can kind of break up into different modules and take it on an as needed basis or at your own pace. So I did develop that. So that's really fun.
Yeah. So how did you figure out how to do that? Because I know, like, again, you've worked in the hospital. It's not like you woke up with this knowledge of like how to develop a course. So what did you end up do to, like, you know, for that nurse that's like, okay, wait, I have knowledge. How do I put that into a course? What did you do?
Absolutely. Yeah. So I actually took an online course to teach me how to make an online course. So I did that, and that actually helped me learn the tools, you know, the tools I need to create the course, how to do it, how to market myself, that type of thing, how to make it passive, right? Because that's the big thing is one-to-one was taking away a lot of my weekends with my kids. And so the online aspect makes it more passive. I can provide that link for you if you like at the end of the show, and you can have your
that would be great, so people can check it out.
That.
Tell me a little bit about your Airbnb, because you've recently within the last couple of years picked up an Airbnb, and you've been kind of running that, and you ended up just recently getting Superhost title. So tell me a little bit about that.
I want to brag a little bit, right?
Yeah.
So you know, I mean, my husband and I have always loved like renovation. Like our first house was a fixer-upper. Our current house was a fixer-upper, and we do all the projects basically ourselves. So we enjoy that. And we always knew we wanted to like expand our real estate portfolio, but Miami real estate is so expensive. So it's really hard down here. So anyways, I happened to come across Healthcare Professionals in Real Estate, the Facebook group, and I kind of joined that and kind of started looking at what was going on there. And a lot of people were doing what's called short-term rental, also known as like Airbnb. Yeah. So I kind of piqued my interest. I was like, I think I could do that. That's, you know, if these people can do it, they're working healthcare jobs. I'm working healthcare job. I think I might be able to do it. So they still have a group there on Facebook. They're still doing weekly Zoom meetings, and I would go to every single weekly Zoom meeting because I would have a different guest then. I was listening to all the podcasts that I could get my hands on. I was reading, you know, all the things they tell you to do when you're interested in something. I was doing all of it. And then last year we ended up getting a short-term rental actually out of state in Alabama. Wow. So we manage it remotely, and it's been going really well. Yeah, it's definitely not passive. It's not passive like the online course too much. I mean, there's a lot of involvement that goes into it. But if I can manage it from Miami while working part-time, I mean, there is some passive aspect there as well.
Sure. Mm-hmm. And you've been doing the Airbnb for how long now?
So we went live in March. So we purchased
not quite a year.
Last December, and went live in March. Mm-hmm.
So whenever you were going to these you were listening to podcast episodes, you were just consuming ferociously how to launch this, you know, Airbnb. What are some of the takeaways that you felt like as healthcare providers was the easy part to get into, and then the parts that took a lot of time for you to kind of develop for someone that's interested in, okay, well, here she is course developing and she's in Airbnb. I'm a little more interested in the Airbnb part. Where did you how did you get started in that sense?
So for me, analyzing the financial aspect of it was the hardest part, probably, like seeing what property would provide me my best return. Luckily, my husband is also my partner, and so he helped me a lot with that aspect to kind of find the perfect property, because that's the whole reason you get into it, right? You don't want to get into a situation that you can't afford, and that's part of a side hustle to create passive income or additional income. So that for me was probably the hardest, but being a healthcare provider, the easiest part is probably just being compassionate and having that hospitality aspect, right? We are constantly caring for other people, and that's really what it is in Airbnb. People want to be cared for while they're on vacation, you know, putting that little extra touch in everything you do and just reaching out and saying, hey, I'm here if you need anything. That came really easy, and that has a lot to do with the success of being an Airbnb host and having people return and all of that. Mm-hmm.
Is that what you're noticing? People are coming back?
Oh, yeah. I haven't been live. You know, it's a beach market, so I haven't been live a complete year, but they're saying they're going to come back, and you just get better feedback. I notice when I'm a little bit more personable with guests. It's been fun. You meet a lot of people from all over. It's been really fun.
That's really cool. So it's kind of, again, like expanding your network, you're meeting people and you're making a little money on the side. Hey, listen, like, again, over time, it'll just start to pick up. And if your reputation precedes you and people are like, no, this place is great, you got to stay there. They'll word of mouth share it. And or maybe they won't because they don't want people to take it from them. So I'd be like,
don't give any people any ideas. No.
And then, your last, side hustle is also our NP SMP, which is our Etsy shop that we've been working on together, which you developed first. And I just was like, I want to help with this endeavor and grow this business. And so, kind of take me through what made you decide to start your Etsy shop, and then I can come in with what made me want to join.
Yeah. So I don't know. I love purchasing things on Etsy. So I
So
just
cute.
it was always kind of my little dream on the side to open my own Etsy shop. So did that. And then, there's a huge market for digital products. I mean, they're super useful in a lot of aspects, not just like art, but resources, study guides. I mean, you name it, you can create it, And so I think how we kind of came together is that we saw that there's a need there for nurse practitioner students, nursing students, just healthcare providers in general, right? To have resources available to them. Mm-hmm.
Yeah, no, I felt the same. And that's why I wanted to join. And again, because of my work on the podcast and like creating content, I have gotten a little bit of a skill with Canva. And I was like, I'm starting to kind of really enjoy like creating and things like that. And when I saw like, oh my goodness, she's doing this and that. And I was like, Jackie, like, can we develop stuff? And can I help like, build? And I really have enjoyed getting to, again, create content that I feel like I would want. And I use our NP calendar that we created.
I do too.
I use it every day. I just pull it up and I write in there. And so for those of you who haven't checked out our shop, we actually have created a couple things since we decided to link up Endeavor, and we've created a dated calendar and as well as an undated calendar. And people are like, what, a digital calendar? What do I need that? But what's really great is that every year I would always purchase a planner to like keep my life organized. Every single year, I would just go about finding this perfect planner, and you buy the stickers and you buy all the little pieces to it. And you sit there and you're like, just putting on the little pieces together, and then just begin realizing like, wait, there's this digital space where you can like create like put it on your iPad and then just go onto your iPad and just erase it, and you can add on. And on the paper planner, I would always make mistakes and have to erase it, and I'm like, oh man, I don't have a sticker for that, and like just stuff like that. And then again, like I said, nothing was ever tailored to my profession. It was always just kind of random stuff. It was never
generic.
It was generic, exactly.
Yeah.
When you and I were thinking of stuff to create, I was like, I think this would be really, really good. And I think that, again, I think other people would want this as well. And so it's neat for the Etsy shop to kind of, it's almost like the world is your oyster. You can just create endlessly and then just post it and just say like, hey, this is what we're thinking would be valuable. Like, what do you think?
Yeah.
And getting feedback on that. So what else have we created as well? Just recently we created something else.
We just started doing some personalized nurse practitioner or healthcare provider portraits. I recently had a nurse practitioner student who rotated with me. So I had created her one and she loved it. I framed it, gave it to her, and she was super taken aback by it. So I'm all about the personalized gifts and like keepsakes. I think they mean so much to the recipient. So, and it's fun for us to create it,
Yeah.
So we've done that. We've done the planners. Yeah. And there's a lot of stuff. We have a lot of stuff coming up too that we're going to be introducing to the shop. A lot of study guides, a lot of like, I wouldn't call it a study guide, maybe more like a notebook, like a condensed notebook for specialties, kind of an all-in-one type thing that's coming up in the months to come.
Yeah. And then one of the things I like about the portraits too is that like we're making them individualized. So you can request to have like, hey, my bestie is graduating from nursing school. I want to give her something that will be like something encouraging to her. And again, like you just download, you let us know like what you want. We build it out for you, and then we ship you the digital download, and then you can use it as much as you want. You could print it up for her, put it in, frame it, like you can just do whichever.
Right.
And yeah, it's just such a cute thing. And I was showing my mom, and she's like, oh my God, this is so cute. I was like, I know, isn't it cute? Like, it's so...
I love your mom's accent that you make for her. It's pretty spot on though.
I first did her accent to her, like I was in trouble and I was like mocking her or whatever. And she's like, okay, first off, that's a really good accent, pero stop. Okay. And so it was just this hilarious moment with my mom where I was just messing with her. And then for our last endeavor that we're in, Jackie, are you tired? Because I'm tired. Just listening to this.
I feel like people are going to think we're making this up at this point.
I know, right?
We are hustling mothers. We are.
No one's going to believe that we have families and children. And they're like, no way. These women are crazy.
Yeah.
And so the other thing that we're involved in, you and I, again, going back to the creating content part, we're also a part of NP Hub, which is something that we're going to be rolling out as well. Booklets with them and their company. And it was just kind of crazy when I interviewed Krish for the podcast. I shared with him that we were creating these booklets, which are, again, they're going to be launching on our Etsy shop. You guys can definitely check them out when they finally launch. But yeah, I was chatting with him, and he had said, oh, wait a minute, what are these booklets? You know, we'd explained it to him, and he really wanted to get on board. So we're creating a whole separate collection of workbooks for them as we are kind of rolling out stuff with our Etsy shop. So do you have anything you want to speak on that? Or
So I think they're really a valuable resource for students that are either rotating in the clinical specialty and you kind of don't know what to expect. You can get a leg up on the specialty before you step foot in that office. You have to remember that clinical rotation is like an interview. So you want to be prepared. You don't want to be blindsided. Not that you have to know everything, but you're going to be super impressive if you can know a little bit, right? Or at least have your hands on resources to know the answer to a question. In addition to that, it's nice to have it if you're also transitioning from a student to actually being a healthcare provider, because you know a lot of that is learning on the job, right? So you may have done a labor and delivery rotation, but now you're on the labor and delivery unit and you don't even know what you're doing. So use that as like a reference tool, a refresher. You know, I just think it's wonderful. Like, I wish I had something like this when we were in school.
Yeah,
you know?
for sure. Because I just felt like I was always winging it. Like I never had a cheat sheet, you know? And so that's kind of what we're creating, a cheat sheet for nurses and nurse practitioners it's aesthetically pleasing. So like if you're in your nursing, if you're in your nurse practitioner rotation and you're an RN and you want something before you go to clinical, it's just, you know, your PEDS rotation from a nurse practitioner side, you'd be able to really tap into this resource and immediately go like, okay, I got these things under my belt. I'm not so green. And so I think it'll be a really nice thing that we're providing for the students. And then also on our Etsy shop, we'll have that. And throughout your whole career, I know there's been highs and there's been lows throughout your process. So could you tell me about a time that's been a real struggle as we've been creating all these side hustles and doing all these jobs and, again, balancing motherhood and also balancing your career? What have been some moments that you're just like, I'm not going to make it, I can't do this, that you've been able to overcome? When
I first became a nurse practitioner, the first nurse practitioner job I was offered, I took it, right? And it was a toxic environment. It was really bad. And I was second guessing my decision to go back to school. And why did I do this? I should have just stayed as an RN. And so that was a low for me, but every time a door closes, another one opens. It's so true, because when that door closes, another door opened, and I could just see how unhealthy that first job was and how I, meant to have a healthier position. Now, fast forward to all these side hustles, it is a challenge, right? If I have 3 boys and I do work part-time, but that's 3 days a week, and being, a mom is a full-time job. And so it's a lot to take on. But I think if you can really manage your time well and remember why you're doing it and try not to let the lows and maybe not an overnight success, because nothing's overnight, right? Everything's a work in progress. To not let that get you down, I think that, you're only going to go up from there.
Yeah. And it's been one of the things that I have also noticed is that sometimes when you look at the whole elephant, it's daunting. You're like, there's no way I'm going to eat this elephant. This is nuts. Like my gut's not going to. Why am I eating this elephant?
Why?
Why am I eating the elephant? Okay.
Right.
I'm not even hungry anymore.
Yeah.
So that's of course what always is going on in the back of my mind. And then again, I just tell myself, just take the next step. Just take the next step. And that all toil brings about a profit. So it's just crazy that, like, again, you and I were just creating this digital stuff for my podcast. You were creating it for your Etsy shop. We were both kind of creating stuff. And then it was like, hey, listen, like, do you want to join together? And I think that's been a really nice addition, because it keeps you motivated when you're with someone. Like, you don't want to let your partner down. Your partner doesn't want to let you down. You're also like communicating, you're talking about it. You keep each other encouraged, kind of just hard by yourself, like it really is just that mentality.
It is,
And then once you get somebody else, it's kind of like, no, I'm grinding too. Like, let's grind together. Like, you're just like, I keep going. Okay. All right. She's going. And sometimes like you'll say like, Sandra, I don't know how you do all that. And I'm like, Jackie, I don't know how you do all that. Like, you have 3 children. And so it's just nice to see else that's
to relate to someone. Yeah, absolutely.
Yeah, exactly.
Yeah. And we always kind of knew that we were going to do something together. I feel like we always knew. We've been friends for too long not to have something together.
I know,
you
right?
know.
Isn't that funny? I
So
did
you're
kind
over
of
in
know
your
that too.
urology world and I'm over in my women's health world. But now here we are in our Etsy shop.
Yes. And again, like I said, we want to create beautiful things for nurses or nurse practitioners, because we're noticing that like we're kind of missed. Like nurses are hit on a lot. Like there's a ton of content and stuff for nurses, but nurse practitioners are just kind of like, I don't know, we kind of get lost somewhere between a doctor and a nurse, you know? And so as we were kind of talking, we're like, hey, what do we need? Like, why isn't somebody like targeting us with like cute stuff that we can use that is for us? And so I think that's what's really special about the SuccessNP Etsy shop, is that this is targeted at nurse practitioners. Like that's what we want. That's our niche that we're really trying to invent and create content for. So we really encourage you guys to check it out and and you know, again, give us feedback too. If there's something that you want us to create, please message us. We are so open to creating for the need. Like tell us where the hole is. Tell us where something's missing.
Yeah.
All right. And so for the last question of the podcast, I typically ask people, you know, what's something that if you could go back and tell Jackie, you know, when we first met in nursing school 20 years ago, not to yourself, 16, give me those 4 years, that you would have told her at the very beginning, what would you have said? A piece of advice.
So I'm not going to say what everyone else says, even though it's true about going to med surg. I think that I think you need to know your value as a new nurse. I think a lot of times, even though I feel like it's moving away from it, there's a lot of the nurse eating their young mentality still around. So know your value, stand up for yourself, and you're going to be just fine. You're going to be just fine. Yeah.
What about a piece of advice that if they hear is garbage, toss it?
Piece of advice that they hear, I think, is garbage.
Yeah, garbage. Trash.
Trash. There's a lot. Oh, man. Let me see.
Something that you're like, if you hear this, don't listen to it. If somebody tells you this, don't even pay attention to it.
I don't know. I just feel like follow your gut, really, because there's going to be a lot of nurses that are going to teach you, well, it's always been done this way, or just do it this way. And, you know, I just follow your gut, follow your protocols, stay safe, and just, you know.
That's good.
Especially as a new nurse, I feel like you can get intimidated easily. So just stick with what you know. Ask a ton of questions. I mean, who cares if someone gets irritated? Ask a ton of questions. You know, it's better to ask than do something.
Yeah, I agree.
Yeah, I think just following your gut, you know, I think we sometimes overlook what we feel and kind of ignore it, and we're being paranoid, but following your gut is important.
Yeah. I think one of the things that you and I have talked a lot about in regards to kind of looking back and thinking, you know, we wish we would have developed side hustles sooner. Like if you and I could go back.
Oh God, yes.
You know what I'm saying? Like we would have been hustling, you know, 10 years ago, 15 years ago.
But I feel like it's a different time now. I feel like it just wasn't a thing when we were younger, you know?
It's true.
I mean, it's just, you go to nursing school, you become a nurse. Oh, you become a nurse practitioner, and then you work in the hospital. And that's it.
Yes.
You know, but I love how it's just expanding. Like we're seeing, I mean, your podcast, right? You're seeing all the ways that you can use your nursing degree to do unconventional nursing jobs, or, you know, think outside the box.
Yes.
I think it's great.
And the skills translate, like you said, like caring for people. Oh, it's what we do. So you can totally be an Airbnb host, because just channel your hospitality when somebody comes into your room that's assigned to you, and you're like, welcome to the hospital. Welcome to my Airbnb. And I'm making money in a different way that doesn't require me to do the things that I do in the hospital. So it's just, again, like I think our skills equate to so much more, that I feel like when I went to school, I was told, okay, so your skills allow you to work on the hospital and do bed baths and also pass out meds. No one told us that, like, no, Sandra, like, you don't realize that, like, these skills translate into business things. Like, you can use them to develop other things that could help you when you do have 3 children and you want to go part-time and you're like, how do I make more income? It's like, oh, honey, you've got so many more skills than you realize. Like, let us show you how, you know? So for the last part of the interview, Jackie, the rapid fire questions.
I feel like there should be some music now.
What was your very first job ever?
Oh, Cece's Pizza cashier.
Shut up. I did not know this about
Hi,
you.
welcome to Cece's.
Nailed it.
I think I was like 15 or 16. Yeah. Yeah. And then I did a lot of babysitting after that one. And I think that job lasted 6 months and I was like, I'm not doing this.
Oh my
It was
gosh,
rough.
that is hilarious.
Yeah.
And then what is your favorite board game or just like game that you like to play?
Favorite board game is I play Trouble with the kids a lot. It's kind of
that little pop game with the middle thing.
My kids are little still, so they can all play that one.
Yeah, that's fun.
Yeah.
You know what is my favorite game that we play is when we beat our husbands when we go on our vacays. When we beat our husbands on charades.
Yes.
Yeah,
We're telepathic. We don't even have to do a movement. You know what I am? Okay, you got it.
It's so not fair, and that's why I love to play it. I love to play it.
Yes, we're gonna crush this.
Yes.
Yeah, it's coming up again, isn't it?
Oh, that's funny. Okay, this one's hard. Are you ready for it? This is a hard rapid fire.
Okay.
So what was the last word you had to look up to see what it meant?
Oh God, that's
next. No, I'm just kidding. No.
Yeah, I can't even remember the word, but a man commented on one of my Instagram posts. I had to look it up because he felt like the male species was being attacked by my Instagram post. So I had to look it up, and I was like, moving on. Next.
That's really
I don't remember
funny.
the word. Yeah.
That has honestly been one of the challenging things as well as the posting on social media.
Oh yeah.
All that whole thing. That's a whole separate side
that's
hustle.
a whole separate job.
Yes, 100%. Like I know why people hire people to do that stuff.
Yeah.
It's just and to manage it. It's like, man, I don't even want to look and see what people are posting. Sometimes people are not kind, so it's just like better not to know.
Well, just ignore them.
Thanks for coming on the podcast, girl, and just
you.
just talking about what we're doing and what you're doing and where people can find you. Again, just share your handles, and so people that are listening can find out what Jackie's up to.
I'm at Perfectly Pregnant Collective, and I have a little Instagram profile there, and you can find the healthcare provider course that I took on my link there as well, and I'll share it with you too. And then all my side hustles are there.
Awesome. Well, I will put it all in the show notes, guys. Check her out. Yeah. Thanks for coming on.